Some of the most interesting patients that we see here in the clinic are those patients that literally have had no experience with cannabis at all. For those patients that have never used cannabis or have not used a cannabis products in a number of years, very important to let them know about what they're going to feel from the THC component of the cannabis product. But there surely won't be a dangerous side effect profile. The most important thing, there will be no respiratory depression at all. And quite frankly, even at its worst, if you're having an anxiety or a paranoid type of feeling from it, some simple relaxation techniques, believe it or not, sucking on a lemon has been shown to kind of eliminate that quicker, that feeling of negativity that you may have. But in general, it's very mild intoxication. It's quite interesting too, just to compare the intoxication effects between alcohol and cannabis. Alcohol, I like to say, is an accentuator of normal moods. For example, if you're a wedding and you drink, you tend to become happier. Champagne effect, so to speak. But if you're depressed and sad and you drink, routinely you're going to become more depressed, more sad. The next time you drink, once again, even more so. So there's a definite negative spiral to it. Cannabis, on the other hand, the research seems to show that in a situation of mild anxiety or depression, the utilization of an appropriate medical cannabis product with THC in it will give definitely some raising of the mood and relief of that anxiety type of feeling in general for most patients. One of the greatest things about the side effect profile of the cannabis products versus the opiates, for example, is literally the lack of a significant danger from overdose of cannabis. Nobody, at least in the medical literature, has ever overdosed on cannabis. You can't smoke or ingest enough of the product to give you respiratory depression. Obviously, it's well known for narcotic abuse, both in the intravenous and oral fashion. Definitely overdoses are still occurring every day. I saw the statistic the other morning of 91 opioid deaths daily across the United States. So we know from the side effect profile that the cannabinoid products are literally a do no harm product, where obviously from the narcotics and also from alcohol, let's face it, you can easily drink a half a bottle of vodka and get yourself into a state where you'll never get to, no matter how much of the cannabis products that you use. You can walk into a liquor store today and obtain a product that can surely take you to a much worse intoxicant level than any cannabis product. And of course, any patient that walks into my office today can be prescribed by myself, the holder of an active DEA license, a number of narcotics, Percocet, Dilaudid, or benzodiazepines, Ativan, Xanax, or quite frankly, other class of products that can be much more dangerous on both an acute and chronic basis.